What do you do when you can't take a statin or you have to reduce the dose of your statin? One option is a medication called Zetia, Ezetimibe. The reason this matters is because too many people have high LDL for way too long, and every single day of high LDL is increasing the chance of blockages in arteries. So today I'm going to talk about why Zetia can help you with a second door in your LDL metabolism. We're going to go over some key data, some of the risks and benefits, and a consideration of who might benefit. I'm Dr. Huck. I'm here to provide you evidence-based medical wisdom, no hype and no gurus here, just the facts. So this is a diagram of how your body recycles cholesterol. On the left, we see that the liver normally makes cholesterol, and statins work by blocking the liver from really making that cholesterol. However, there's also a backdoor that's mediated by this receptor, the NPC receptor. And what Zetia does is it reduces the absorption back into your body after the cholesterol has made it into your system. So Zetia works by reducing absorption. So statins work on the front end, Zetia works on the back end. So Zetia will make your liver pull LDL out of your blood. And here's the key thing. When you add Zetia to a statin, you get an additional 23 to 25% reduction in your LDL cholesterol. So it's a multi-layered defense for LDL reduction because many people cannot go to the highest possible dose, the maximum therapy for statins, or they can't tolerate a statin at all. So what are the data on the benefits of Zetia for outcomes beyond LDL? So a 6% drop in major heart events, a 12% drop in non-fatal heart attacks, and a 17% drop in non-fatal strokes. These are non-trivial findings from very large studies. So personally, I take Zetia for these reasons because I want to reduce my heart attack and stroke risk, and I've always struggled with high LDL. The other thing is that often when you combine treatments, you're going to get a better chance of getting to your target compared to with one treatment. So a high-intensity statin, on average, about 58% of people will reach their goal for LDL, but with a combined strategy, 72% will. And there's likely fewer side effects because the person doesn't have to go to the maximum dose of the statin. And that's pretty great. However, you must keep in mind that the people who are going to benefit the most are the people who are the most at high risk. So if somebody's had heart attacks and they've already had a surgery called CABG to unblock an artery, if they already have diabetes and hypertension, if they're a smoker, if they're above age 75, these are the highest risk categories, and those are the people who need Zetia the most. So someone like me, who's in my mid-40s, I'm not going to benefit as much. That being said, why would you turn down any benefit? The way I think about it is that I'd rather reduce my risk by 3 to 5%. Maybe it's not 20% or 17%, but it's something important. Our medical system is great at acute care, but what really matters is preventative medicine. That's my whole approach. What about the safety of Zetia? Well, it's pretty well tolerated, actually. Muscle pain is comparable to placebo. So if somebody has muscle problems with statins, this is a great option. Liver enzyme elevation is fairly uncommon, about 1%. And there's about a 4% risk of diarrhea and respiratory infections as the most common side effects, which you should still keep an eye on for sure. Now, if somebody is above 75, they're also at the higher risk for side effects on high intensity statins, but also side effects on Zetia. So you got to watch out. People who have also chronic kidney disease can benefit from Zetia. It's been shown to reduce cardiac events by 17%. Chronic kidney disease is extremely common, but most people don't get their numbers checked because kidney function gradually declines with age on average. So you want to talk to your doctor and figure out if you're a candidate. If you had persistent LDL above 70 or 100, depending on what your goals are, and you've tried some lifestyle interventions, you've tried some statins, definitely something to consider. But if you've already had a heart attack or stroke, even more of a reason to think about added protection. If you've had difficulty tolerating statins, perhaps you've had muscle pain, that's a really good reason. And if you're one of those people who has a genetic syndrome of high LDL cholesterol, you definitely should talk to your doctor about this. A few other considerations: high LPA and high ApoB. You've seen some of my other videos on this. These are markers that predict blocked arteries and heart attacks. If you have high LPA and high ApoB, that's another reason to be more aggressive with your LDL reduction. If you have peripheral artery disease, which is blockages in the blood vessels in your legs, for example, that's an indication that you probably have blockages elsewhere in your body too, because your arteries are going to clog up generally in the same way. So think of that as a warning sign of what's going to happen to your heart. which means you might want to be more aggressive. Erectile dysfunction is often a canary in a coal mine because the small arteries of the penis are going to block faster because they're smaller. And if somebody's having difficulty with blood flow down there, it means that they're probably at a higher risk than average for heart disease. So you might want to be more aggressive. And remember, there's many causes of erectile dysfunction. We're talking about the problems with actual blood flow. Chronic kidney disease, I also mentioned why. Statin intolerance, but moderate intensity Crestor or rosuvastatin, when combined with Zetia, is no different than high intensity rosuvastatin by itself. So what that means is that if you can't tolerate a high intensity statin, you can get the benefit for cardiovascular outcomes if you add Zetia to the lower intensity dose of the statin. That's great because many people can't tolerate the highest intensity statins. So what's it like to take Zetia? Well, it's not as strict as you might think. You can take it on an empty stomach or with food once a day, 10 milligrams, standard dosing. It's been studied for many years. It's fairly cheap and cost effective. It has a generic. So those are often not the hurdles. So stepping back now, in terms of LDL reduction, 18 to 20%, heart attack prevention, about 6%. And in terms of safety, it's quite comparable to placebo. It's a fairly safe medication. And a 17% reduction in stroke risk is amazing. So I'm a big fan of Zetia. That's why I take it. And as I mentioned, I see this medicine as a lock to get that second door, the back door, to help your LDL. You don't want to leave the back door open just because the front is locked if you're on a statin. And that's how many people, including myself, try to get under 70 for their LDL. I do hope this has been helpful for you. If you like this, check out this other video or join my free newsletter, medicalwisdom.org, for some more personal and evidence-based takes that can empower you to take charge of your health. Thank you so much.